Choking is a life-threatening situation and happens when the casualty's airway suddenly gets blocked so that they cannot breathe normally. Usually, choking in small children is caused by a small foreign object, whereas in adults it is most commonly food. If the blockage of the airway is mild, the casualty should be able to clear it by coughing. Any blockage of the airway should be taken very seriously, as within a short time of the brain being starved of oxygen, brain damage can occur.
The recognition, signs and symptoms.
Grasping of the throat, anxious and distressed, difficulty in speaking and breathing, persistent cough, pale grey-blue skin developing, becoming unconscious.
Let's now look at the treatment.
Once you have established the casualty is in fact choking, your first action should be to calm and reassure the casualty and encourage them to cough. If this is not successful, then you should stand behind the casualty, leading them slightly forward, supporting their upper chest with either one hand or your arm across their chest, and give sharp back blows between their shoulder blades. These back blows should be attempted on 5 occasions. Check the mouth and remove any obstruction. If your back blows were unsuccessful, then you should attempt to give 5 abdominal thrusts. Again, stand behind the casualty and place both arms around them, leaning the casualty forward. Place one fist just below the breastbone and cup the fist with the other hand, as shown on the video. Then pull sharply inwards and upwards to try and force the obstruction out. Again, you should make 5 attempts with abdominal thrusts to remove the obstruction. If this is unsuccessful, you should repeat the cycle of back blows and abdominal thrusts. And if after 3 cycles the obstruction is not cleared, you should then call 999. If at any time the casualty becomes unresponsive and unconscious, you should support the casualty to the floor, call the emergency services as soon as possible, and commence basic life support.
So, in summary,
Encourage to cough up the obstruction first. Calm your casualty. Likely to become weak and lose consciousness within a few minutes. Make your movements sharp and firm. If not successful, with 3 cycles, dial 999.
With a choking baby, you should hold the baby in a similar position as a recovery position by supporting the baby with their head pointing downwards. As with an adult or child, you should first attempt 5 back blows. If this is not successful, turn the baby over and attempt 5 chest thrusts. If this is also unsuccessful, you should repeat the cycle of 5 back blows and 5 chest thrusts. And once again, if the object or obstruction has not become clear after 3 cycles, then call the emergency services.